Hi, I'm Dr. David Hill, and today we're going to talk about how to treat ringworm in children. So, how do you know your child's got a ringworm? Well, first of all, let me be clear. A ringworm is not a worm. That sounds kind of icky. It's actually a fungus. Isn't that better news? It's not a worm, it's a fungus. How great. Well, fungus is still kind of icky, but the fact is, we're all kind of buses for fungi. We all have fungi on our skin. Usually they're not causing us a problem. Children's immune systems are not great often at fighting off fungus infections, so they're a little more susceptible to getting manifestations of their fungi infections. How does that happen? Usually it starts as just a little itchy place, usually pretty round in shape, and then over the next several days the itching spreads. Usually the middle of the lesion clears and the edge of the lesion is more bumpy or scaly. That produces the ring-like shape that we're all used to. Now, just because a lesion is round does not mean it's necessarily a ringworm. Eczema can look like that, psoriasis can look like that, a condition called granuloma annulare can look like that. So when you're in doubt about whether this is or is not ringworm, you want to have the child's doctor take a look at him or her. There are a variety of ways to tell the difference between these two conditions. But what if it is plain garden variety ringworm? The great news is a prescription is almost never needed. There are great antifungal medicines available over the counter. Go to the athlete's foot section and look for miconazole, clotrimazole, you want nizoral, ketoconazole is another choice. Buy any of them. It does not matter. The thing that does matter is that you want to treat around the lesion, not just the spot, but go for a good inch around the edges of the spot. There's fungi out there, there's just not bumps yet. The hardest part about treating is continuing to treat long enough. It takes a while for this medicine to work, easily 2 or 3 weeks. After the ring that you saw was gone, you still want to treat for another week. I got to tell you, it's hard to treat something that doesn't seem to be there anymore, but really do your best to do that part because that's what's going to keep that lesion from coming back in the future. Now, if you've given the medicine for a week or two and nothing is happening, that may not be a ringworm, and you want to have your child examined by a provider who can help figure out what's going on. So talking about how to treat ringworm in children, I'm Dr. David Hill.